While the slides are charged, I would like to introduce myself. My name is Joan Bigorra. I'm the Director of Innovation of the Barcelona Global Health Institute and also Senior Advisor of Innovation of Hospital Clínic Barcelona. The ISGlobal, the Barcelona Global Health Institute, is an institution which is a private public institution that nowadays has around 500 investigators, and we have an income of around 50 million, of which only 20% are given by the Board of Trustees, and the rest is financed through competitive calls, European Commission, the Bill and Melinda Gates Foundation, and the National Institute of Health mostly. So very briefly, because we are really short of time. Okay, I will carry on. Okay, so this is ISGlobal. We have a number of programs. You see that the programs go from climate change to air pollution, also through neglected diseases. I want to remark, will not go through all of them, of course, for the sake of time, but I want to remark that we are truly global. We have research centers, research and innovation centers in Europe, also in Africa, two centers in Africa, one in LATAM, and we have collaborations with almost every country in the world. We are also very much focused on the 17 sustainable development goals. And I would like to pay attention to the Sustainable Development Goals number 10, number 16, and number 17, because sometimes are not fully explained. And 10 is equity, and that's crucial. Without equity, I think that someone mentioned this before, it won't be planet health without equity, or more equity than we have nowadays. And the 16 and 17 refer to justice. The 16 and the 17th is partnerships. And again, this table is about partnerships, so it's a very important sustainable development goal. We work also very focused, we are very much focused. We start with science, but then we also go through the translation, that is innovation, and we move towards making an impact through translation structures, cooperation and development, and we work in the ground, we work in the countries, in the place, not theoretical at all, but also very much practice. To end this presentation, I would like to insist on the point of innovation. This was a study done by the Boston Consulting Group, that they made an assessment about what was the gap between what we are spending nowadays to make the 17 Sustainable Development Goals feasible by the year 2030, and what should we be spending. And the gap is around $2.5 trillion. To give you an idea, this is roughly 3% of the gross domestic product worldwide. So this is completely unrealistic. So the key for success is working together and making technologies available to those that are more in need. Again, digital health and technologies are an absolute must in order to achieve equity and to improve global health. And the partnership, we need to learn how to work together, the social sector, the academia, and the private sector, because it's the only way changing things and challenging the reality and challenging the status quo, which innovation is about challenging the status quo, is the only way that we will be successful. So that's the final slide. This is a quote from a Nobel Prize in Economy, saying that the train was the economical engine in the 19th century. The automobile, the car, was the economic engine in the 20th century, and health innovation will be the economic driver of progress, of humanity progress in our century. Thank you.
At the time of presenting an innovation, which barriers have you found and how did you overcome them?
Thank you. Yeah, the main barriers, I would say, that are the lack of a shared purpose, the lack of trust, and the lack of commitment. So the solution to me is have a clear purpose and a well-focused purpose, a clear governance, strong leadership, then strong commitment, and commitment means money, and a good follow-up. I mean, this is easier said than done, but I think we must learn to be very tough about the soft issues, because the soft issues are the ones that make things difficult in public partnerships.
Thank you.